It's not radical to eliminate private insurance in America. Radical yet historically grounded proposition: eliminate private insurance companies from the U.S. healthcare system and cap physician salaries and prescription drug prices at no more than the Consumer Price Index, CPI. This isn't a fringe idea, it's a return to the progressive roots of early 20th century reform efforts, blended with lessons from Europe's efficient models. By dismantling the profit-driven insurance oligopoly and imposing sensible price controls, we can align US per capita healthcare spending with European levels, limit potential downsides through smart implementation, and position this as a cornerstone of the democratic socialist movement. Ultimately, this transformation is essential to preserve Social Security and other vital social programs from fiscal collapse. The history of health insurance in the United States is a tale of missed opportunities and corporate entrenchment, underscoring why removing insurers is not only feasible but necessary. As far back as 1912, Teddy Roosevelt and the Progressive Party endorsed social insurance, including health coverage, as part of their platform, envisioning a system that prioritized public welfare over private gain. The real pivot came during the Great Depression in the 1930s, when hospitals introduced prepaid plans. This evolved into Blue Cross plans, initially non-profit, but it laid the groundwork for employer-sponsored insurance, which exploded during World War II wage freezes as a tax-advantaged benefit. Post-war, Franklin D. Roosevelt's push for national health insurance through the Social Security Act amendments faltered, vetoed or diluted amid Cold War fears of socialized medicine. Instead, private insurers filled the void, transforming healthcare into a profit machine. By the 1960s, Medicare and Medicaid emerged as partial public solutions for the elderly and poor, but they coexisted with a burgeoning private sector that now siphons billions in administrative waste and executive bonuses. This hybrid system, born of compromise, has ballooned costs to a $5 trillion behemoth where insurers deny claims to boost profits. History shows that when public options were sidelined, as in the failed Clinton Health Plan of 1993 or the ACA's public option compromise in 2010, private interests entrenched further, leading to today's inequities. Capping salaries and drug prices echoes European post-World War II reforms, where governments imposed controls to rebuild societies affordably. Persuading Americans means reframing this as reclaiming Roosevelt's unfinished legacy: healthcare as a right, not a commodity. Critics decry such reforms as utopian, but the math tells a different story. In 2023, US per capita healthcare spending hit $14,570, nearly double Europe's average of about $7,393 in high-income OECD countries like Germany and France. Removing insurers would slash administrative overhead, which consumes 8% of US spending, $400 billion annually, versus 3% in Europe, yielding immediate savings of $1,166 per person. Capping drug prices at CPI, preventing real growth beyond inflation, could reduce costs by 70%, aligning with Europe's negotiated rates and saving $874 per capita, as US prices are 3 times higher. Similarly, capping physician salaries, currently $350,000 on average versus $200,000 in Europe, at CPI-adjusted levels would trim 5% off totals, or $626 per person, without impoverishing doctors. Combined, these changes could cut US spending by 20%, bringing per capita costs to around $12,000 initially, with further convergence as efficiencies compound. Europe's systems prove this. Germany's multi-payer model keeps costs at $7,383 per person through global budgets and price caps, delivering superior outcomes like longer life expectancy. The US could match this by redirecting savings into universal coverage, proving that affordability isn't about scarcity but reallocating trillions from profits to patients. Skeptics warn of innovation stifling, doctor shortages, and reduced access, but evidence suggests these risks are overstated and manageable. Capping drug prices hasn't halted European pharma giants like Novartis or Roche. Instead, it fosters value-based innovation over price gouging, with studies showing US price reductions could save $6 billion annually on just 10 drugs without curbing R&D. Physician salary caps at CPI would still yield competitive pay, far above national averages, mirroring Europe's stable workforce, where doctors earn well but without US-level debt burdens from medical education. Single Payer analyzes Project Minimal Disruptions, a CBO report on illustrative systems estimates GDP impacts of -0.3% to +1.8%, with coverage gains offsetting any shortages through incentives like loan forgiveness. Europe's wait times are often exaggerated, primary care access is superior, and overall mortality rates lower. By prioritizing prevention over profit, downsides evaporate, replaced by a healthier populace. Implementation: building a streamlined, equitable system transitioning requires bold but practical steps. Phase out private insurers over 5 to 10 years by expanding Medicare to all, funded via progressive taxes on high earners and corporations, mirroring proposals like Bernie Sanders' Medicare for All. Centralize electronic health records through a national database, reducing errors and costs by 5 to 10% as seen in Europe's interoperable systems. Enforce CPI caps via federal negotiation boards, similar to the Inflation Reduction Act's drug pricing mechanisms, which already cap out-of-pocket costs at $2,000. States could pilot integrations, addressing legal hurdles like ERISA preemption through waivers. This isn't chaos, it's evolution, building on existing infrastructure for seamless, equitable care. A banner for democratic socialism, mobilizing for change. DSA's platform envisions universal coverage with equal access, aligning perfectly with price caps to dismantle capitalist exploitation in healthcare. To elevate it, DSA chapters should integrate it into electoral work, endorse candidates pledging support, organize town halls, and build coalitions with unions and communities of color disproportionately burdened by costs. This isn't just policy, it's class struggle, empowering workers against big pharma and insurers, and positioning democratic socialism as the pragmatic alternative to neoliberal failures. The imperative: safeguarding our social safety net. We must act now, or unchecked healthcare inflation will devour Social Security and programs like Medicaid. Rising costs already erode benefits. Medicare premiums grow faster than inflation, claiming more of retirees' fixed incomes, while employer health contributions reduce payroll taxes, funding Social Security by billions. Federal healthcare spending drives national debt, threatening solvency. Experts warn tariffs and cuts could exacerbate burdens on these programs. By adopting this reform, we bend the cost curve, freeing trillions for social investments. History demands we choose equity, our future depends on it. Thank you for watching.